We often read, speak, or hear about the word euthanasia, but do we really know what euthanasia means? Well, euthanasia is defined as the intentional and painless taking of the life of another person, by act or omission, for compassionate reasons. There are important concepts involved in the euthanasia definition. For example, voluntary euthanasia is at the person requests. Non-voluntary euthanasia is without the consent or opposition of the person. Involuntary euthanasia is against the person's expressed wish or decision. We also have active euthanasia, which is a positive contribution to the acceleration of death. Passive euthanasia is the omission of the step which makes sustain life. There are several arguments to go for euthanasia. Euthanasia provides a way to relieve extreme pain. It also provides a way to relieve when a person's quality of life is low. Frees up medical funds to help other people that may need it, and it is another case of freedom of choice. A good example of euthanasia is the Oregon, Washington, and Vermont death with dignity laws, which allow mentally competent, terminally ill adult state residents to voluntarily request and receive a prescription medication to hasten their death. Among the requirements, a patient must be 18 years of age or older, resident of Oregon, Washington, or Vermont, capable of making and communicating healthcare decisions for him or herself, diagnosed with terminal illness that will lead to death within 6 months. The state departments of health enforce compliance with the law. Compliance requires physicians to report our prescriptions to the state. Physicians and patients who comply with the law are protected from criminal prosecution. Physicians and healthcare systems are not obligated to participate in the death with dignity laws. Several safeguards in death with dignity laws ensures all patients are protected, and if they wish to use the law, they are in full control of the process. These safeguards and the request process ensures there is no chance patients are coerced to hasten their death. Brittany Maynard was diagnosed with brain cancer at age 29. After trying all possibilities to find a cure, she was told that there was nothing left to do. In April 2014, she was given 6 months or less to live. Brittany decided to move with her family to Oregon to access that state's Death with Dignity Act. The law gave her the option to take life-ending medication if her dying process becomes painful, so she can pass away gently and peaceful, at home in the arms of her loved ones. I have clearly stated my position for euthanasia. I should be allowed the chance to stop my suffering whenever I see fit. It is my choice that should come before any else's.